Thank you. Okay. Um, Good day, everyone. My name is Elugbaju Opeolu Emiade, and I'm presenting. Mm, please, I'm having issues scrolling. I can't get to find it. Okay. I'm presenting on risk perception and impact of Ebola virus disease on work and personal lives of nurses and healthcare workers in National Hospital Abuja. The summary: Ebola virus disease (EVD). The EVD epidemic in West Africa has ravaged the social fabric of three countries: Guinea, Liberia, and Sierra Leone, with a death toll of over 11,400 people and over 21,200 cases as of January 15, 2015. The disease was first noticed in Nigeria in 2014. In August 2014, a Liberian came in with Ebola virus. He actually went to a private hospital. Thank God it was tracked from there. And in August 2014, the WHO declared Ebola virus disease epidemic a public health emergency of international concern. Travel-associated cases have now been documented in 5 additional countries, and effects are being felt worldwide. So by the end of July 2014, a symptomatic case traveled by air to Lagos, Nigeria, where he infected several healthcare workers and airport contacts before his condition was recognized to be Ebola virus disease. Basically, there are 5 species of the genus Ebola virus, which is Viloriidae family. So one is Zaire Ebola virus, Sudan Ebola virus, Western Ebola virus, Typhus Ebola virus, and Bundibugyo Ebola virus. The outbreak in West Africa was caused by Zaire Ebola virus. That's the most common one in West Africa. The viruses can survive in liquid or dried material for many days. They are inactivated by gamma irradiation heating for 60 minutes at 60 degrees Celsius or boiling for 5 minutes. And they are very sensitive to sodium hypochlorite. That's the bleach that we are another disinfectant. It's also believed that when you wash, especially washing your that Ebola virus can be killed. So the transmission, the human to human transmission of the virus is primarily associated with direct or indirect contact with blood and body fluid. And the transmission to health workers has been reported when appropriate infection control measures have not been observed. So if personal protective equipment are not being used or universal safety precautions are not being put in place, there is high likelihood that health workers will be infected with Ebola virus disease. Transmission to healthcare workers has been reported when appropriate infection control measures have not been observed. The danger posed by emerging infectious disease has resulted in significant stress and concerns amongst nursing personnel, of course, and other health workers too. Um, Since, but this research is more for nurses and, of course, other health workers. So, since nurses are one of the frontline healthcare providers, they are at risk because we have direct contact with patients. So nurses are at risk during infectious disease outbreaks. Understanding their fears and anxieties may hold lessons for handling future outbreaks, including acts of bioterrorism. The consequences and impact of the Ebola virus infection cut across all human experiences at personal, family, institutional, community, and national level. So the effect of Ebola virus infection cuts across all human experiences. The problems, the questions that are identified to be answered in research, or that were answered in the research rather. One, what is the risk perception of contacting Ebola virus by nurses stroke health workers? What is the impact of perceived Ebola virus on their personal lives? What is the impact of perceived Ebola virus on their work lives? What is the level of use of universal precaution measures to prevent Ebola virus disease in national hospitals? Also, the danger posed by emerging infectious disease has resulted in significant stress and concerns amongst nursing personnel. Since nurses are one of the frontline healthcare providers, they are at risk during infectious disease outbreak. Usually at the emergency room, nurses are the first set of people to receive patients. They are the ones mostly at risk when there is outbreak. Consequently, the researcher decided to study the risk perception and impact of Ebola disease on work and personal lives of nurses and healthcare workers in National Hospital Abuja, Nigeria. Since December 2013 and as of 12th October 2014, there are 8,997 cases of Ebola virus disease, including 4,493 deaths, has been reported by World Health Organization in 7 reporting countries. One additional case was reported by the US on 14th of October, that's in 2014, in a second healthcare worker in Dallas, Texas, who tested positive for Ebola virus after having cared for the first case in the US. The consequences and impact of Ebola, okay. The Ebola virus victim suffers not only effect of the illness but also stigmatization. For example, like when it happened in Nigeria that time, a lot of people ran away. Some people were not allowed into their homes so they would not affect other people. So even after the healthcare workers have been treated and they were declared free of Ebola virus, they were still stigmatized that they had psychological issues as regards Ebola virus infection. The disease was imported into Nigeria through a visitor from Liberia, and EVD was officially documented in Lagos and Port Harcourt, that's Rivers State in Nigeria. The methods for the research. The target population for this research are members of staff of the hospital, of National Hospital in Abuja, with special reference to the clinical staff, the doctors, nurses, radiologists, and scientists. Because usually we are the ones having direct contact. They are the ones having direct contact with the patients. So that's the target population. Then there was use of descriptive non-experimental design with systematic probability sampling method. There, um, there was use of 100 out of 1,000 members of clinical staffs. They were selected randomly to participate in the research with the use of a well-structured questionnaire. The questionnaire has 9 units. So the chi-square test was used to evaluate difference in the proportion of respondents according to job category, physician, nurses, and other, sex, age. Also, the data was analyzed using the statistical method of percentile and presented on frequency distribution tables, pie charts, and bar charts. So the results and discussion. The study was carried out to determine the risk perception and impact of Ebola disease on work and personal life of nurses and healthcare workers in National Hospital Abuja, Nigeria. Most of the respondents were clinical staffs. There are 72 people, 72 respondents, in which 35 were medical doctors, 37 were nurses, and of course, the 25% of the respondents consist of the laboratory and radiology staff, and only 3 respondents were non-clinical staffs. And the result shows that the respondents interviewed were between the ages of 21 and 60, and of course, that's the active years of service. And about 27% of them were below 30 years, 61 were between 31 to 60 years, and only 12% of the respondents were 51 years and above. The results presented revealed that many of the healthcare workers have a high risk perception on contacting Ebola. And as a result, and this is as a result of lack of adequate treatment, and there is also rapid spread of the disease virus. Ebola virus disease uh, spread so rapidly that in the absence of adequate management, or um, in the absence of sporadic management, there might there might be high infection rates among the healthcare workers. So when there is an outbreak and there are poor control measures and awareness, and there is also lack of adequate treatment and rapid spread of disease virus, the results show that that people had a high risk perception. And of course, from one of the tables, that's table 4. Sorry, I don't have the graphs here and the tables here. So when the
Ms.
result
Opeolu?
reveals that 3/4 of the
Hello?
respondents were, yes,
Hello, Ms. Opeolu?
hello, I'm with you.
Yeah, you got another three
Yes,
more
I can
minutes,
hear
so
you.
please finish. Yeah, yeah. Got another 3 more minutes to finish.
Okay,
All right.
okay. So, so the result presented in table 4 reveals that 3/4 of the respondents were afraid of the impact of contacting the disease virus, as there was no adequate care, leading to an untimely death of the person. Also, the fear of spreading the virus to members of the family, and ultimately the society at large. 85% strongly agrees to the fear of being stigmatized even by professional colleagues. Also, one of the results shows that there was high impact on respondents' work life, where there is lack of willing volunteer during disease outbreak because of the stigmatization. Also, findings reveal that it is high, with 64% impact on lack of willing volunteers. And the result in figure 2 shows that there is high use of universal precaution measures in national hospital by respondents in the various departments, showing that there is high awareness of the benefit of measures for the safety from communicable diseases. So, in conclusion, Ebola infection among healthcare workers have had a devastating effect on health system, including closure of hospitals, depletion of much needed healthcare workforce, and distrust. The World Health Organization report further states that Ebola has exacerbated the pre-existing shortage of healthcare workers, high rate of attrition, uneven distribution, poor employment conditions, gaps in occupational health and safety in 3 infected countries, that is Guinea, Liberia, and Sierra Leone. Thank you.